please do self-exams, not just women but men as well, because women check themselves a little more than men do, and the concern is that even though it's only 1% of men that get breast cancer, by the time men find their breast cancer, it's already so far advanced that sometimes not a lot can be done. So it is really just spreading that awareness and making sure that women and men are aware that they need to be checking themselves for breast cancer.
Men and breast cancer, like you're talking the man boobs, like
Yes.
feeling them.
Not just man boobs, but guys that are well built.
Fully chiseled. You wouldn't see the bump like sticking out, or
sometimes you would, but sometimes you might not, right?
Okay.
So it might be such a small bump. It might be like an iceberg where it grows 10% on top, but then it grows into the muscle.
Majority.
So that's where you're concerned about it.
Okay, now speaking of self-examination, you mentioned earlier that is how you kind of found that, you know, you had breast cancer and that's what initially got you to go to the doctors. How does one complete a self-exam?
So the big thing with the self-examination is you want to do it once a month, usually 5 to 7 days before after your period as a woman. Now, when you basically want to feel yourself up. That's basically what you want to do here. So for example, you would start on the axilla, which is up here. So you can kind of feel that there's a pectoral muscle that'll connect to your chest.
Can I just say, you're publicly about to feel yourself up. Can I just say to the audience, like, have some appreciation here. It takes a ballsy woman to not just get through and survive breast cancer, but to publicly feel her up for the audience's well-being.
Basically. So the biggest thing to know is you want to start at the top, which is right underneath your arm, and then you want to kind of press quite hard, so it's going to hurt a little bit, but don't like dig into your skin by any means. So you want to kind of just press it hard, but like all your fingers down. So you want to take 2 to 3 fingers while you're doing this, and so you work it down onto the top of the 12 o'clock of your breast, and you're going to go kind of like massaging it in a dime format, and then go around your entire breast, like all the way around. And then when you get back to the top, you go just a little bit into here. So you're making a spiral on your breast up into the point where you get to your nipple. And when you get to your nipple, you kind of want to either squeeze it just to make sure as a woman that there's no abnormal discharge. So that's the biggest thing. If any of those things occur and you either feel something or you have abnormal discharge, please make sure you go see your doctor and just have another physical, or go get a mammogram or an ultrasound.
Worth it in the long run, hey?
Absolutely.
And like Esther was saying,